Hi, welcome back to Med Rounds. I'm Dr. Tim Moser. Today's discussion is cholesterol. Now, cholesterol is a very interesting thing because your body needs cholesterol in order to survive. Cholesterol is used both in the manufacturing of cell membranes and also as a basis for all the hormones that your body needs. So your liver actually makes this cholesterol primarily when you sleep at night. However, we all know that if you have too much cholesterol in your bloodstream, it can cause problems. It can plug up the arteries, causing a heart attack or a stroke, and in some cases can even cause peripheral vascular disease. Now, most people know that cholesterol can come from the diet. Cholesterol is made by animals. So if you're eating animal products such as eggs, cheese, meat, all of that contains cholesterol. Plants also make cholesterol, but to a much smaller degree than animals. So eating more of a plant-based diet means that you're going to have less dietary cholesterol. Not all animal products contain high amounts of cholesterol. A good rule of thumb is if you're eating a fatty type of meat, like a sausage for instance, it's going to contain much more cholesterol than a leaner cut of meat. Now, for years we've known that there is a correlation between your cholesterol level and your risk for heart attack and stroke. There are several numbers to keep in mind here. For most people, the total cholesterol should be less than 200, and that's the goal that we're shooting for. But that's not the whole story, because when a doctor does a cholesterol test on a patient, we're looking at a lot more than just your total cholesterol. Other things included in what's called a lipid profile not only include the total cholesterol, but also the LDL, HDL, and triglycerides. LDL stands for low density lipoprotein. Now, the LDL is the part of the cholesterol that's the most deadly. So some people remember the LDL as the bad cholesterol because L stands for lethal. The level of LDL that you want in your bloodstream really depends upon your risk factors. Now, overall, lower is better. But if you're a person who is relatively young and doesn't have any risk factors for heart disease, such as high blood pressure, smoking, or family history of an early heart attack, your LDL should be 140 or less. However, if you have diabetes or if you've had a heart attack in the past, or had a stroke, or have a strong family history of heart disease, your doctor may want your LDL as low as 70 or less. HDL is another type of cholesterol. HDL stands for high density lipoprotein. A good way to remember this is that the H in the HDL stands for healthy. So the HDL cholesterol is the good cholesterol in your blood. And to some extent, the higher the HDL number is, the better off you are. So for most people, we would like to see that HDL greater than 50. Now, in some rare cases, if your HDL gets way over 100, then it may stop being beneficial and may in fact be deleterious to your health. But for most people, over 50 is what we're shooting for. You can increase your HDL level by regular exercise and dietary modifications. The third thing examined in a lipid profile is your triglycerides level. Triglycerides are not cholesterol. They're actually a fat. When you eat fat, your body breaks it down into the smallest building blocks possible, and these are the triglycerides. The triglycerides are then absorbed through your intestine, enter the bloodstream, and go to the various cells of your body. The cells of your body take up the triglycerides and, like building blocks or Legos, assemble the larger fats that are needed for that cell to function. Now, a good general rule of thumb is the triglycerides should be less than 150. Some people, when their triglycerides get up above 300, 500, 1,000, they're at a much higher risk for not only a heart attack, but also other types of conditions, such as pancreatitis. In the big scheme of things, the most harmful element in a lipid profile are the total cholesterol and the LDL. Those two are the ones we pay the most attention to. Getting the HDL up is also protective. Triglycerides are a risk factor for heart attack and stroke, but unless they are very elevated, are less of a risk factor than the total cholesterol and the LDL. Now, screening, doing a blood test to check to see what your cholesterol level is, should be done by everyone once they reach adulthood, by about age 20 to 21. Now, if you have a family history of early heart attacks or very high cholesterol, some pediatricians recommend testing even in the teen years, especially if there are other medical conditions going on, such as obesity. In patients younger than 21, medication is oftentimes not used to lower cholesterol. Instead, diet and exercise is the keystone of therapy. Let's assume that your total cholesterol or LDL is too high or your HDL is too low. What can you do? Most experts would agree the best place to start is with diet and exercise. Although cholesterol is manufactured by your body, most of the cholesterol that we measure usually comes from the diet. So reducing the amount of fatty animal-based foods that you eat can certainly help lower that cholesterol level. And it also helps lower your triglycerides. Instead of meat, substituting a more plant-based diet, also fruits, nuts, grains, can also help with those cholesterol levels. Exercise plays a very important role in keeping your cholesterol under control. A moderate intensity exercise such as walking for 30 minutes most days of the week can have significant effects, not only in your total cholesterol, lowering the LDL, but also increasing the HDL. In some cases, diet and exercise are not adequate to lower the cholesterol or the LDL levels down to a healthy level. And in those persons, drugs are usually prescribed. By far, the most common category of drug used today to help with cholesterol and LDL concerns are the statin drugs. Now, statin drugs aren't without risk. Areas of the body affected by the statins include the liver and your muscles. Any patient that is taking a statin drug is usually closely monitored with blood tests to make sure that no liver damage is occurring. Some patients are unable to tolerate the side effects of statin drugs due to muscle aches or to liver damage, and in those cases, different drugs are available to help lower the total cholesterol and the LDL. This has been Dr. Tim Moser with MedRounds, wishing you the best in health and prosperity. Until the next time, take care.